And in Chapter 3.7, understand the meanings of and the differences between procedures, rules, and policies. Understand the various elements of agency structure. Understand the distinction between power and authority. And understand the 5 sources or bases of power. In this exam, you will also be responsible for the material within the appendices, with the exception of Appendix A. Appendix A has some very good information. This can be a valuable tool in evaluating stress and fatigue, but again, there will be no questions on the exam regarding Appendix A. Appendix B and Appendix C both refer back to TAP 21A. And you will really need to spend some time on both of these appendices in order to make sure that you fully understand and be able to distinguish between the components of foundation areas and the performance domains. In Appendix B, within the foundation areas, really understand the theories, rules, and modalities of clinical supervision, leadership, supervisory alliance, critical thinking, and organizational management and administration. And know the competencies and understand those competencies within each one of those areas. There will be a number of questions on the exam regarding the information in this appendix, and here is an example. Within the TAP 21A foundation areas, which of the following describes leadership? So in order to answer that question correctly, you would need to know all of the components of leadership, and you'd have to know which would fit into that description and which would not. Just like in Appendix B, within Appendix C, know the performance domains very well. Understand the difference between counselor development, professional and ethical standards, program development and quality assurance, performance evaluation, and administration. Know and understand the competencies within each of those performance domains. An example of a question on the exam would be within TAP 21A, performance domains in clinical supervision include counselor development, which includes all of the following competencies except, and then you would have to identify which competency was not included as a counselor development competency. Here is a hint for this section of the exam. The incorrect answer will be taken from one of the other competencies. That way, if you know the competencies that should belong to, for example, counselor development, then you'll see that the incorrect answer should go with a different competency. And then finally, in this book, you should know Title 42, Code of Federal Regulations, Part 2, which relates to confidentiality of alcohol and drug abuse patient records. Know the purpose and effect of this federal law relating to confidentiality of client records. Know what the penalties are for violation of these statutes or regulations. Know what the restrictions on disclosure apply to and how that disclosure might be made. And know and understand when disclosure may be made without patient or client consent. The last section of exam questions comes from material within the MAT Counselor, which is a handbook for certification of counselors working in a medication-assisted treatment setting. As a clinical supervisor or program manager, you will need to have a basic understanding of this specialized treatment setting. You will not be tested on all the aspects of being an MAT counselor, but certainly as a supervisor, as a private practitioner, you need to have a certain understanding of some of the major oversight responsibilities So the only chapters that you will be responsible for in this textbook are chapters 7, 11, and 17. So within chapter 7, know and understand the differences in the brain of addicted and non-addicted individuals. Know and understand what the National Institute of Drug Abuse research has shown about opioid-dependent individuals. Know and understand the primary goal of methadone treatment and what effect the medications have on the client or patient. And know and understand the meaning of higher and lower doses and what each means as they relate to risks of overdose. In Chapter 11, know and understand and be able to distinguish between the characteristics of the 5 stages of change. And finally, take some time to study Chapter 17, which is a very good description of opioid maintenance treatment programs. Understand the factors that contribute to the stigmatization of methadone as a treatment modality. Understand how negative attitudes affect OMT. Understand the unique aspects of opioid dependence and be able to identify the goal of opioid agonist medications. Understand the typical dose of methadone that most patients will need to achieve stability. Within an OMT program, understand which technique is appropriate in making dose determinations. Understand how tolerance impacts patients who require pain management. And understand the interaction of pregnancy and opioid agonist treatment. That concludes the tutorial, and we'd like to remind you of a few things. You will only be tested on the material in the 3 textbooks identified in this tutorial. If it is not in these textbooks, it will not be on the exam. You will be responsible for Section 2 within the TAP 21A publication, the entire Clinical Supervisor book, with the exception of Appendix A, and within the MAT Counselor book, you will be responsible for all the information in chapters 7, 11, and 17. If there is a conflict between what you previously learned and the textbook material, answer the questions based on the information in these books. The exam is not easy, but if you know the material in the books, and as pointed out in this tutorial, you should pass the exam. And when you pass this nationally developed and scientifically validated exam, you will demonstrate that you have the knowledge and skills to be a competent supervisor or to manage a private practice in an alcohol and other drug or substance use disorder treatment setting. Good luck on the exam, and keep up the good work that you are doing in this honorable profession.